Modern Dental Assisting, Chapter 15, Dental Caries. Dental caries, also known as tooth decay, is the most common chronic disease among children, teenagers, and adults over 65. So, emphasis now in the dental office is on preventing future caries with our hygiene and not just dealing with decay that's already present. Bacterial infection, there are two specific groups of bacteria found in the mouth, and these are both responsible for dental caries. They are found in a relatively large number in dental plaque, and the presence of lactobacilli in the mouth indicates a higher sugar intake. We'll talk a little bit about oral biofilm or plaque. This is colorless, soft, and sometimes sticky coating that adheres to the teeth. It remains attached to the tooth despite movement of the tongue, water, rinsing, water spray, or a less than thorough brushing. Formation of oral biofilm on a tooth concentrates millions of microorganisms on that tooth. The enamel or the crown of the tooth is the most highly mineralized tissue in the body. So, enamel is stronger than bone and it consists of microscopic crystals of hydroxyperoxidate arranged in structural layers or rods, and these are known as prisms. The enamel crystals are surrounded by water. The water and protein components in the tooth are important because it's how the acid travels into the tooth and the minerals travel out, and then the tooth structure dissolves. So, with the caries process, in order for a cavity or caries to develop, we have to have three factors: a tooth, a diet that's rich in carbohydrates, and a specific bacteria. Areas that we can develop caries include pits and fissures on the occlusal surfaces and the buccal and lingual grooves of posterior teeth, and then also on the lingual pits of the maxillary incisors, smooth surfaces, root surfaces, and then we can also develop secondary or recurrent caries that would occur on a existing restoration. Stages of caries development. Caries is an active, ongoing process characterized by alternating periods of demineralization and remineralization. Stage one is where the caries begins to demineralize the enamel, and stage two is the development of that cavity or lesion. In secondary or recurrent caries, this is going to form in the spaces between the teeth and the margin of a restoration. This isn't always easily seen, thus, diagnosis is difficult. New restorative materials may prevent recurrent decay. Root caries is going to occur on the root of teeth that may be visible with gingival recession. This is becoming more prevalent and is a concern for members of the elderly population who often have gingival recession, which would expose that root surface. Older people often take medications that are known to reduce saliva flow. So these can be medications that are for blood pressure or maybe anxiety. Sometimes allergy medication can reduce saliva flow, and this can contribute to caries. ECC or early childhood caries is an infectious disease that can happen in any family. Tooth decay is the single most prevalent disease of childhood. Some of the risk factors for ECC would include a lower socioeconomic status, particular ethnic groups, if the family has limited access to dental care, and then lack of water fluoridation. ECC is transmissible, and it's a bacteria that the parent or the caregiver would have and then pass then to the child. So it's important for parents to keep their own teeth healthy in order to keep their children's teeth healthy. Baby bottle tooth decay is another term for ECC. The importance of saliva. Physical protection involves a cleansing effect. Thick or viscous saliva is less effective than a more watery saliva in clearing carbohydrates. Provides a chemical protection, contains calcium, phosphate, and fluoride. Antibacterial substances in saliva work against the bacteria. If saliva function is reduced for any reason, the teeth are at an increased risk for decay. We talk about dry mouth and medications that cause dry mouth. Dry mouth is also known as xerostomia. So, in order to diagnose caries, we have a method that's used. Each method, though, has limitations, so try to use a combination, the Dental Explorer, radiographs, visual appearance in the oral cavity. We have indicator dyes available. There's laser caries detector, and then optical coherence tomography. Collecting data helps the dentist to determine a treatment protocol. A dental health professional assesses an individual's risk and protective factors that determines the level of risk for caries. Not all patients are equally at risk. An individualized preventative plan is developed based on the determined level of risk. Caries assessment systems, caries management by risk assessment is an evidence-based strategy for preventative and reparative care for early dental caries that can be used in any office. The ADA caries classification systems categorize location, site of origin, extent of disease, and activity level of caries lesions.